At what blood lactate concentration does a doctor typically start worrying about a patient in a clinical setting? And how does that compare to like what an elite cyclist produces on a hard climb, for instance?
Yeah, I've actually said this on the podcast before that physiology of exercise looks a lot like disease. So, like, blood pressure will be up, heart rate will be high, you might have high lactate, your respiratory rate would be up. Like, if you gave the same numbers at the top of a climb to a doctor, they'd freak out. So,
Mm,
it's quite interesting to think about how, like, the concept of hormesis is something we talked about last week, which is like these stressors make us come back stronger. It's also probably why fit people tolerate being ill better, can clear it and can deal with it better. I think it'll depend, but anytime you're seeing a significant metabolic acidosis or a raise in lactate above baseline, so probably 1 millimolar is, I don't know what answer it's got there, but I would be using it always as a concerto of data. So always looking at all of the things. I wouldn't ever specifically look at it. I'm sure there is a value that it has, and I'm not sure what it is
says basically
there.
more than 2 millimole, higher than 2 millimole, doctors would be like if you're sitting in a hospital and that's what you tested, doctors would be alarmed. Whereas like a pro cyclist on a hard climb, like is way, way, way more higher than that.